This has also been ignored. The amount of miscarriages and stillbirths that increased drastically due to your advice to get vaccinated. Pregnant women again, not people. And then we could go on and on about the tragic stories of myocarditis and many other things. But my question for you today, Dr. Walensky, is now that you're going to be leaving the CDC pretty soon, what job are you going to take? Are you going to be on the board of either Pfizer or Moderna? Because you've done one hell of a job at making sure that they've made a lot of money. And I yield back.
Thank you for that question. Maybe first I will comment that CDC is not responsible for the purchase of vaccines, so I can't speak to all of the economics that you spoke to. I do want to talk a minute about the vaccine adverse event reporting system. So that system is intended for any person who has gotten a vaccine, if they have an untoward event after that vaccine, whether or not is related to the vaccine, they report. It is intended to have an over-reporting. All of the not all, most of the vaccines that were being given, remember we gave 676 million doses of the vaccine. Any adverse event, if you got hit by a truck after you got your vaccine, that was reported to the vaccine adverse event reporting system. We at CDC have a responsibility to comb through every single one of them, to review the medical charts and to see if they are related. It is the case that the vaccine doesn't prevent being hit.
Ms. Walensky, I'll reclaim my time. You did nothing about that and continued to push vaccines. That's what the American people care about.
We review all of the things that come into the vaccine adverse event reporting system. I'd be happy to have our staff educate your staff on the work.
I don't want my staff educated. You should educate the American people about what you've done of 1.5 million reports, because they feel like you've done nothing and continue to say safe and effective.
Maybe I will just close by saying I don't have plans after I step down. Thank you.
The CDC frequently communicated with big tech and social media companies to coordinate the censorship of posts that express skepticism or criticism of the COVID-19 vaccines. Dr. Walensky, is there a difference between medical opinions and misinformation?
There are things that are scientifically proven over and over again in the literature, and those eventually become fact. But I think that there are ways to interpret that.
Exactly. Reasonable people disagree on a medical path forward, correct? I mean, that.
Yeah, but I would also say that when there is increasing science, that leads to fact that more and more people then generally agree.
I mean, patients often are advised to get a second opinion on medical advice. CDC records, however, show that CDC officials sometimes flag social media posts which they deem to be misinformation. My question is, did the CDC work with private companies to influence the censorship of dissent about vaccines?
You know, that topic is one that is under litigation in the courts, so I will not be speaking to that.
Recently, Meta CEO Mark Zuckerberg said that during the COVID-19 pandemic, the establishment kind of waffled a bunch of facts and then asked for a bunch of things to be censored that, in retrospect, ended up being more debatable or true. Did the CDC work with Meta, or I like to call it Facebook still, to censor or otherwise alter any post?
Here's what I can tell you. The most important thing that has gotten us out of this pandemic, I think, is our vaccine and how well they work and how safe they are.
I understand that.
And it was really important that the American people understand how well they worked and how safe they are.
I understand it.
But in terms of the communications, that is, again, something that I'm not going to speak to because it is currently under court.
So you're not going to answer the question?
It is currently under court litigation.
I hear that so much on everything we do. It's currently under investigation. Did the president take a bribe? Dr. Jackson, it's currently under investigation. Did the CDC ever work with Facebook to craft internal policies on censoring posts regarding the COVID pandemic?
Again, this is something that is under court litigation. What I will say, though, it is so very important to get correct, factual information out to people to understand the overwhelming benefit of these vaccines over the very minimal risks.
What about Twitter? Can you answer that?
Again, under court
litigation. So you
litigation.
refuse to answer the question?
No, what I'm saying is it is under court litigation, and I will say that the most important thing that we were working towards at CDC is to get facts out to people so they understood in plain language what was important, which is that the
I'm going to reclaim my
work.
time. Facebook's policy on coronavirus misinformation dated February 8th, 2021 said that it would purge, quote, false claims, including the notion that COVID-19 is man-made or manufactured. Director, did the CDC ever recommend that Facebook or other companies censor posts promoting the lab leak theory?
We're speaking to the same thing. These are all situations that are under court litigation. I will not be speaking
Did the CDC ever recommend that Facebook or other companies censor posts suggesting that vaccines did not prevent the infection or spread of COVID-19?
What was most important to CDC was to get information about how well the vaccines were working and how safe they are. And, you know, many of the questions, all of the questions that you're asking are along the same lines. They're currently under litigation in the courts.
In one email, a CDC official tells a Twitter employee that, quote, CDC is working on a project with Census to leverage their infrastructure to identify and monitor social media for vaccine misinformation, unquote. And that they would, quote, like the opportunity to work with Twitter's trust team on a regular basis to discuss what they are seeing, end quote. So, Director, did the CDC work on a regular basis with Twitter or other companies to monitor or censor vaccine misinformation?
Congressman, my answer is the same. It's the same line of questioning. We wanted to get important information out to the people so that they would favor vaccines because they were working. They were preventing severe disease and death.
I understand. But it turns out that some of the perspectives that the government censored, like the lab leak theory and some questions about the vaccine, were correct all along. But the government censored that. A lab leak is possible. I would go even further to say the lab leak is probable. Even some in the government have admitted that. The vaccine did not stop spread or infection. I'm not saying it was completely bad, but it did not stop the spread or infection.
I think, actually, if I could actually just correct that point, and that is initially it did. For the Wuhan strain and for the Alpha strain, all of the early data and the literature published in the New England Journal demonstrated that for those who worked, if you didn't get infected, that you were not transmitting it to other people, and it had very high efficacy early on, up to 96%. So it did change over time.
I understand. I hate to interrupt, but my time's expired, but that's something that this committee is going to continue to investigate. But with respect to censorship, censoring dissenting opinions is unacceptable, and that's something else that this select committee needs to investigate. We don't need to see that ever happen again, and I look forward to trying to present the truth to the American people about what role the government played in censoring dissenting medical opinions, which may well prove to be true. Madam Chair, I yield back.
One of the things that was interesting is I, too, was threatened with my license. I did get censored as a physician who treated thousands of COVID patients by people on the internet, by people in government, telling me I couldn't express my professional opinion as a doctor and as a scientist. Ironically, it goes full circle, and it came, once again, from the politicization of this, where people thought they were experts based on I'm powerful, rather than I actually know what I'm talking about. And ironically, the things they censored me on, I turned out to be correct on. They wouldn't even allow a dialogue of medical professionals to actually debate the science on a national scene, rather than just one size fits all, we're going to let the government decide what's truth. And this is the problem I have with this. You mentioned during the opening statements, you said, or actually during the open question, you said that we didn't get information on vaccinated hospitalizations, which surprised me. I thought we did have some of that. I imagine that also carried over to ICU visits and probably deaths too, because if we don't have that.
Just to be clear, we don't have that at a national level. We at CDC collect data in cohorts so that we can follow that for vaccine effectiveness studies. But at a national level, we get hospitalization data, we get hospitalization for COVID data. But at a national level, we have never been able to get hospitalization, vaccination, and COVID.
Yeah, so that worries me because it seems to skew the data. And I see you nod your head, yes, I agree.
Well, I think it just speaks to the real challenges in our data flows and our ability to give data back to the American people when we don't have full line of sight of all the data that people are interested in.
Couldn't agree with you more, which I spent so much time, every time I admitted a patient, every time anybody was tested for, I filled out an egregious amount of EHR paperwork in order to answer every question before I did any treatment or any admission. And yet, we never collected data on one of the most important statistics of all, which is vaccinated patients and the effectiveness of hospitalizations versus ICUs versus deaths. There wasn't a fair conversation. It seems like that was avoided. Were you asking for that information, or was that just something that they didn't want to collect?
So, Dr. McCormick, let me just be clear. We were looking at that in our vaccine effectiveness cohorts, in our Vision and IV cohorts, so that we could report that out on vaccine effectiveness data. We were looking at that because we knew that that was critically important. But I do want to emphasize that we did not get data in aggregate. We are, again, just to be clear, we're not looking for PII here. We did not get data in aggregate on vaccination and hospitalizations. All that data that you're filling out in the EHR does not translate into public health data. And that is really why I've said our data highways are so clearly important if we are going to report on what is, on the outcomes that people are asking for. And our data authorities are so clearly important so we can present those data in aggregate.
I now recognize Mr. Jordan from Ohio for 5 minutes.
Thank you, Mr. Chairman. Doctor, why did you and the Biden administration mislead the American people?
You'd have to say more. I
March
wouldn't claim that I did.
29, 2021, vaccinated people do not carry the virus. Vaccinated people don't get sick. We got that information from clinical trials, but also real-world data. It seems to me there are a number of statements you make in there that aren't accurate. Do vaccinated people carry the virus?
In March of 2021, the vast majority of data demonstrated that the vast majority of people were not getting infected if they were vaccinated.
That's not what you said. You didn't say the vast majority of people. You said vaccinated people do not carry the virus. Was that accurate?
It was generally accurate.
Generally accurate. Why not just be accurate? Why not just tell the American people the truth? Why don't you say to the American people just what you said to me? We're big boys and girls. We pay your salary. The government is supposed to be of the people, by the people, for the people. Why not just tell us the truth?
I was speaking...
Was 6 weeks later when you said if you were to get infected during post-vaccination, you can't give it to anyone else. Was that accurate?
What was the date of that?
May 19, 2021.
At the time we had the Wuhan strain and then the Alpha strain. That was the Alpha strain that was circulating. That was generally true, yeah.
Generally true again? Why not again? Why not tell the American people this is generally true?
I couldn't tell you the exact data on the vaccine effectiveness of symptomatic disease and severe disease at the time. What I can tell you is that we generally saw that if you were to get infected after you had been vaccinated, that you were not carrying the virus by transmitting it to somebody else. You could not transmit it to others.
But we know that's not accurate.
There is a clear message that is coming through. This is becoming a pandemic of the unvaccinated.
And we're seeing it in the data. Unvaccinated Americans account for virtually all recent COVID-19 hospitalizations and deaths.
We still, to this day, do not have data on people who are coming into the hospitals who are vaccinated. That is a data point that we have lacked.